is Brooklyn. I'm going to be your student nurse today, and today I'm going to be performing a head-to-toe assessment on you. But first, before we get started, I'm going to go wash my hands.
Okay.
Can you please tell me your full name and date of birth, please?
Jessica Ann Robinson, 050804.
And then can I see your bracelet to verify? Okay, awesome. Before we get started, I'm just going to ask you a few questions. Do you know who I am?
My nurse.
Do you know where you are?
Delia.
Do you know why we're here?
A checkup.
Okay, awesome. You are alert and oriented ×4. Do you have any known allergies?
No.
And then approximately how tall are you?
5'6".
And then how much do you think you weigh?
135.
Okay, awesome. I'm noting your posture is good. You are dressed appropriately for the weather. You are well hygiened. I am not noting any odors or anything. Are you able to walk independently and do daily activities independently?
Yes.
Okay, awesome. So you're fully mobile. Do you use any oxygen at home?
No.
Okay, awesome. So you won't be needing any here. On a scale of 0 to 10 for your pain level, 0 being no pain and 10 being the most excruciating pain, what is your pain level?
0.
Okay, if that changes at all during this assessment, please let me know. Your mood is very pleasant and you seem to be very cooperative, which is awesome for me. Now I'm just going to measure all your vital signs. First, I need your right index finger, putting the pulse ox on to measure oxygen saturation, and now I'm going to check your temperature. Okay, open. Your temperature is 98.7. And your pulse ox is 99% on room air, which is good. Now I'm going to measure your apical pulse. I'm going to do this for 1 minute. I'm going to place my stethoscope under your breast, and you may feel me pressing up against it. Okay, awesome. Your apical pulse is at 73, which is within the normal range. And now I'm going to measure your radial pulse. I'm going to do this for 30 seconds. Okay, perfect. Your radial pulse is a 68, which is within the normal range. And now I'm going to do the same thing on this side, but this time I'm going to have it lay across your chest. Okay, perfect. Your respirations were at 14, which is within the normal range. And now I'm going to measure your blood pressure. Is that too tight? Okay, perfect. at 104/68, which is normal for you since you are an athlete. Okay, now I'm going to move on to your skin assessment. First, I'm going to start by palpating your head. Looking for any nodules, lesions, cuts, noting the moisture of your scalp, which is good. Hair distribution, your hair color is blonde. Any pain? Okay, perfect. Now I'm just going to inspect the rest of your body, starting with your arms. Looking for any rashes, lesions, skin breakdown, moles, cuts, bruising, any of that. Noting the temperature with back of my hand and the moisture with my fingertips. Okay, now I'm checking out your hands. Your nails are well hygiened and they're in good shape. Checking capillary refill. Capillary refill is less than 2 seconds, which is good. Now I'm looking for any skin discoloration, jaundice, pallor, erythema, cyanosis, any of that. It's good. Now I'm going to do the same thing up here. Looking for rashes, lesions. Looking at any moles that you have, any skin breakdown, temperature, moisture. Looking at your hands, doing capillary refill. Capillary refill is less than 2 seconds. Looking at any skin discoloration, erythema, cyanosis, jaundice. Now I'm going to do the same for your chest. Looking for any cuts, bruising, moles, any signs of discoloration of the skin. Noting the temperature with the back of my hand and the moisture with my fingertips. Okay, now I'm going to have you scoot all the way back so I can examine your legs. Looking at any cuts, bruises, lesions, skin breakdown, any discoloration, cyanosis, jaundice, erythema. Noting the hair distribution on your legs is normal and evenly distributed. Now I'm going to check for edema on this leg. No edema on this leg. So go down to your feet. Toes are welly groomed. Nice shape, normal color. Now I'm going to check for capillary refill. It's less than 2 seconds. Going to do the same thing over here. It's less than, capillary refill is less than 2 seconds. Now I'm going to check for edema over here. Okay, perfect. Now I'm going to look at this leg for any skin breakdown, wounds, any of that. Bruising, any moles, I'm not seeing any moles. Discoloration. Is there any pain? Okay. I'm gonna have you scoot back forward for me. I'm gonna check your skin turgor over your clavicle. This is just checking your hydration status, which your hydration status is good. Okay, now I'm gonna move on to examining your back for the same things, any cuts, bruises, lesions, skin breakdown, noting the temperature and moisture. I'm not seeing any discoloration, no signs of jaundice, pallor, cyanosis, any of that. Okay, good. And then now I'm going to check for blanching on the bottom of your heel. Okay, good. Okay, good. Now I'm going to move on to your head and neck assessment. I already palpated your head, so now I'm just going to look at your facial features. Your eyes are aligned with your ears and your mouth. I'm going to test your cranial nerve 7. Can you smile for me? Can you frown for me? Can you raise your eyebrows for me? Okay, good. Cranial nerve 7 is intact. Now I'm going to test for your cranial nerve 5. I'm going to place my fingers over your temporal muscle. I'm going to have you bite down. Okay, good. And now I'm going to touch your face with a soft object. So I want you to close your eyes and tell me where you feel it.
Forehead, cheek, chin,
Cheek.
nose.
Okay, good. Cranial nerve 5 is intact. Now I am going to move on down to your neck. First, I'm going to palpate your trachea, making sure it's midline, which it is. Then I'm going to palpate your thyroid gland. It's not inflamed, it's smooth, it's movable, it's good. Okay. Now I'm going to check for JVD, or jugular venous distension of your neck. So I'm going to have you just look this way a little bit and back, and you can relax and use my light. And then palpate proximal to it. I do not see JVD on this side. Okay, now that side. Palpate. I do not see JVD over here. Now I'm going to test the range of motion of your neck. So I want you to look to the right for me, and then the left, and then all the way up, and then all the way down. Any pain while doing that?
No.
Okay, perfect. Now I'm going to palpate your lymph nodes, starting with your preauricular lymph nodes, your post-auricular, your occipital lymph nodes, then I'm moving to your tonsillar, submandibular, and then submental, then anterior cervical, posterior cervical, and then deep cervical, and then your supraclavicular, and then your infraclavicular lymph nodes. Any pain? They did not feel tender or swollen. They looked normal. Now I'm gonna test for, I'm just gonna place my hand on your face, and then I want you to turn into it, okay? Okay. And then show your shoulders. Okay, good. Your cranial nerve 11 is intact. Now I'm gonna move on to your eyes. First, I'm just going to look at them, noting that your eyebrows go the full length of your eyeball. Your eyelashes curve out. Can you close your eyes for me? There's no drooping or sagging of the eyelids. Open. Okay, your sclera is white. There is no inflammation of your vulvar conjunctiva. Now I'm going to place my thumbs on your cheek to pull down to look at your palpebral conjunctiva. There's no signs of inflammation. It's a nice pink color, which is good. Now I'm just going to inspect your pupils. They're round and reactive. Now I'm going to do the pupil size. It's a 4, which is good. Now I'm just going to run a few tests on your eyes, starting with, I'm going to have you look straight ahead. I'm going to come at the side with my light to check for constriction of the eyeball, or the eyelid. Not the eyelid, the pupil. Okay, good. Now I'm going to test for accommodation. I'm going to have you look straight ahead. Place my finger in front of your nose, and on the count of 3, I want you to look at it. 1, 2, 3. Okay, good. They dilated and constricted. Now I'm going to test for alignment of your eyes. I want you to look straight ahead. I'm going to come from above, looking for the sparkle in your eye, which I see. Your eyes are aligned. Now I'm going to test the 6 cardinal fields, which is your cranial nerve, like 3, 4, and 6. I want you to follow my finger with your eyes and without moving your head. Okay, awesome. Any pain? Okay, now I'm gonna look for the red reflex in your eyes using my ophthalmoscope. I'm gonna have you look straight ahead, and then I'm gonna get close. Okay, I see it. Okay, I see it. Okay, now I'm gonna move on to your ears. I'm just gonna look at the shape and symmetry of them. They are symmetrical in the size, everything looks good. Now I'm going to palpate your pinna. Any pain? Your tragus? Any pain? Mastoid process? Any pain? Okay, do the same thing on this ear. Okay, good. Now I'm going to test your cranial nerve 8. I'm going to rub my fingers next to your ears, and I want you to let me know when you can hear. Okay, good. Now I'm going to use my otoscope to look inside your ear canal. I'm going to use a 4mm top. And for an adult, I'm pulling your ear up and back. So I'm going to insert it, and I'm looking at your tympanic membrane. It should be a translucent, pearly, whitish gray color. And I'm noting the bright light reflex in your right ear is at 5 o'clock, and in your left ear it's at 7 o'clock. There is no inflammation or discharge or anything I need to be concerned about, which is good. Okay, now I'm going to move on to your nose. First, I am checking for alignment of your nose, which is midline, and then I'm going to have you look up for me. I'm looking at your septum. It's not deviated. I'm looking at your nasal mucosa, which is a nice pink color. There's no discharge or inflammation or bleeding, which is good. Okay, now I'm going to test your patency of your nares. I'm going to have you close your nostril with one finger and sniff, and do the same for the other side. And okay, any problems doing that? Okay. Now I'm going to palpate your sinuses, starting with your frontal sinuses. Any pain? And then any pain?
No.
This is your maxillary sinuses. They do not feel inflamed or anything. Now I'm going to test for your cranial nerve 1. Can you identify the smell for me?
Vanilla.
Okay, awesome. You are correct. Okay, now I'm going to move on to your mouth and throat. I'm going to just look at your lips, making sure they have a nice pink color, they're moisturized, not cracking. I'm going to have you open up for me. I'm going to use my tongue blade to inspect. Your oral mucosa is a nice pink color, so is your tongue. Your gums are not receding. I don't see any sores or like ulcers in here, which is good. Your teeth are well hygiened. I'm gonna have you open up one more time so you can say ah. Your uvula did retract, which is good. And then can you stick out your tongue for me? Okay, I'm checking for the alignment of your tongue, which is good. Now I'm going to have you take a sip of water and swallow. Any pain? Okay, good. Any difficulty doing that?
No.
Okay, so your cranial nerve 9 and 10 are intact. Now I am going to test for articulation. Repeat after me. Light, tight, dynamite.
Light, tight, dynamite.
Okay, awesome. Now I'm moving on to your respiratory assessment. First, I'm going to look back to see what your breaths were. They were out of 14, which is normal. I'm not noting that you're using any accessory muscles or anything. Do you use any oxygen at home? No. Have you had any trauma to your chest, surgery, or any diseases that affects that?
No.
Do you smoke?
No.
Okay, perfect. So there's no history of smoking. First, I'm just going to palpate your anterior chest. Let me know if you feel any pain. Okay, good. Now I'm going to percuss in between the intercostal spaces, making sure I hear a hollow sound, which I do. That's good. Okay, good. Now I'm going to listen to your lungs. Every time I move my stethoscope, please take a deep breath. I am hearing resonant sounds, which is the normal breath sound I should be hearing over lung tissue. I'm not hearing any adventitious sounds. Okay, good. Any difficulty breathing? You're not shortness of breath or anything? Okay, awesome. Now I'm going to have you swing your legs over that way so I can look at your posterior side. First, I'm just going to palpate. Let me know if you feel any pain. Okay, now I'm going to percuss. And then once again, I'm going to listen, and every time I move my stethoscope, please take a deep breath. Okay, your breath sounds normal. I'm going to have you stay there, and I'm going to have you cross your arms and hold your shoulders. Now I'm checking for lung chest expansion, so I'm going to place my hands here and take a deep breath, noting that my thumbs come apart a little bit, which is normal. And again. Okay, perfect. Now you can swing back over and move it on to your cardiovascular assessment. First, I'm going to listen to your carotid artery with the bell of my stethoscope for any bruits. I don't hear any bruits. Okay, awesome. Your apical pulse and your radial pulse were normal, so you are getting good blood flow to all your extremities and everything. Now I'm going to palpate your carotid pulse arteries one at a time. The rate and rhythm feel normal. Okay, good. Now I'm going to have you scoot all the way back so I can palpate the rest of your peripheral pulses, starting with your brachial pulse. I measured all of these for a minute. Then your radial pulse, and then your femoral pulse, and then your popliteal pulse, and then your posterior tibialis artery pulse, which is right here, and then your dorsalis pediis pulse. The rate and rhythm of all your pulses were normal. They were at a 2+, which is good. I'm going to have you come scoot back up now. Okay, now I'm going to palpate your maximal impulse with my 2 fingers, which is right under your breast right here. Then my palm. Okay, good. Now I'm going to listen to the 5 cardiac landmarks, starting with your aortic valve, which is on your right side, located at your second intercostal space. I would listen for a full minute. Then your pulmonic valve, which is on your left side, at your second intercostal space. And then your Erb's point, which is right below on the sternal border. And then your tricuspid valve, which is at your third or fifth intercostal space. Then your mitral valve, also known as your apical pulse, which is at your fourth or fifth intercostal space. I am hearing normal heart sounds. Your S1 and S2 are good. I did not hear any murmurs or swishing or anything. Okay, now I'm going to move on to your abdominal assessment. I'm going to have you lay all the way flat. And then I'm going to pull this down so I can see your belly button. Okay, now I'm just taking the contour from the side and from posterior. Your contour is flat, which just means you have an athletic build, which is good. Now I'm noting any hair distribution, discoloration, any scars. There's no scarring, there's no bruising, none of that. Your umbilicus is midline and it's inverted. Now I'm going to listen to your abdominal aorta with the bell of my stethoscope, which is located at the end of your xiphoid process between that and your umbilicus. Okay, I did not hear any bruits. Now I'm going to listen to all 4 of your quadrants for your vowel sounds, starting in your right lower quadrant. I would listen to all the quadrants for 1 minute, and if I didn't hear any vowel sounds, then I would listen for 5 minutes. Okay, all your vowel sounds sound normal. They were anywhere between 5 and 30 vowel sounds in each quadrant, which is good. Now I'm going to percuss each quadrant. Let me know if you feel any pain or any tenderness. Okay, now I'm gonna lightly palpate using my 2 fingers. Your abdomen is not hard or anything. Okay, now I'm going to deeply palpate with my 2 hands, and on the release, let me know if you feel any pain because I'm checking for rebound tenderness. Okay, any pain at all?
No.
Okay, you do not have any rebound tenderness. Now I'm going to check for any hernias. I'll palpate right here, and I'm going to have you lift up. Okay, relax. Now do it one more time. Okay, relax. You do not have any hernias. Now I'm going to have you sit up and swing your legs over. Now I'm going to check for your costovertebral tenderness, where your kidneys are. I'm going to percuss with my fist. Let me know if you have any pain. Okay. No pain?
No.
Awesome. Now you can swing back around. When was your last bowel movement?
Yesterday.
And did you happen to see what it looked like? Was it like
I mean, it
soft,
was soft,
normal?
light brown.
Okay, awesome. Now I'm gonna move on to your musculoskeletal assessment. So I'm gonna have you stand up for me, and I want you to walk just normally a few steps, and then turn around. Okay, and then I want you to walk heel to toe. I'm looking at her gait right now. Okay, and then walk on your tiptoes back. Any pain doing that? Okay, now walk on your heels. Okay, she looks very coordinated to me. Now I'm gonna perform the Romberg test. So I'm gonna have you feet together, close your eyes. I'm gonna measure your balance right now. She is not swaying or anything. Her balance seems to be good. Okay, perfect. You can open your eyes. Now I'm just going to look at your back, looking for any deformities or anything. I'm going to palpate her spine. Any pain?
No.
Okay. Her posture is good. Can you touch your toes, please? Her spine is straight. There's no curvature, no signs of scoliosis or kyphosis or anything. Okay, you can stand back up. You can sit back down. Now I'm going to palpate your muscles. Looking for symmetry. They're smooth. I'm not feeling any masses or anything. Any pain or tenderness while doing this. Okay, good. Now I'm going to palpate your joints. Check for crepitus. Just flex up. Okay, good. Same thing with your wrists. Okay, no crepitus up there. There you go. Now flex up. Okay, good. Same thing over here. Okay, I did not feel any crepitus, which is good. Now I'm going to test your muscle strength. So I'm going to place my hand and I want you to push against resistance. Okay. Now up and down, up and down. Okay. Push forward and back, up, down, up, down. Okay, awesome. Now I'm going to do your legs. Lift up, push down, pull back, and then kick out. And then your feet up and down. Okay. Up, down, forward, back. Now flex up and flex down. Awesome. Your muscle strength is good. You were able to push against me. Now I'm going to test your coordination, I guess. I'm going to have you follow me. So lift your arms up. Touch your opposite shoulder, behind your back, and then this way behind your back. Any pain?
No.
Okay, this arm up, shoulder, behind, behind. Any pain?
No.
Okay, awesome. Now I want you to squeeze my fingers as hard as you can. Okay, your grip strength is good. Okay, now I'm going to move on to your neurological exam. First, I'm going to test your immediate memory. Can you repeat after me? Pencil, dog, apple.
Pencil, dog, apple.
Okay, and now I'm going to test remote memory. Have you ever been employed before?
Yes.
When was that?
2019.
And what was your job?
Coffee shop.
Okay, perfect. Now I'm going to move on to testing your upper extremity coordination. So I'm going to have you stand up for me. I want you to slap your thighs with your palm of your hand and the back of your hand. Okay, good. Now I want you to touch all of your fingers to your thumb at the same time. Okay, perfect. Now I want you to touch your nose, and then I want you to touch my finger, and every time I move it, go back to your nose. Okay, awesome. Now I'm going to test your lower body. I want you to rub your heel up and down your shin with your eyes closed. Okay, perfect. Switch legs. Okay, good. Now you can sit down. Now I'm going to do the sensory test. I am going to touch your extremities with a soft object with your eyes closed, and I want you to tell me every time when you feel it.
Feel it. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Okay, perfect. Now I'm going to do the sharp and dull test. So this is sharp, and then this is dull. I'm going to have you close your eyes again and tell me which one you feel.
Sharp. Dull. Sharp. 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 Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull.
Okay, awesome. Next I would do the vibration test, but I don't have a tuning fork. So that's where I would just bang it and put the handle on your toes and let you know if you can feel it. I already tested a majority of your cranial nerves throughout this assessment, but the one I didn't test was your cranial nerve 2, which is your optic nerve. That is where I would use a Snellen chart to see your vision. Now I'm going to test for your reflexes, starting with your brachial. And then your brachial radialis one. Okay, good. Same thing over here. Okay, and I'm going to do your tricep. You got that one. Okay, good. Now I'm going to do your patella. Oh my gosh, I just did over here. Okay, good. Now I'm going to test your Achilles. Okay, good. And then I'm going to do your plantar reflex and your toes did curl, which is good. And now lastly, I'm going to have you, do you remember the 3 words that I told you at the beginning?
Pencil, dog, apple.
Okay, perfect. That concludes our head to toe assessment. Do you have any questions for me? Did your pain level change at all?
No.
Okay, you can get dressed, and thank you for your time.